Good afternoon, guys. I hope we're all sparkly. I hope you have had a productive day so far. Already today, I've jumped in the sea with Her Royal Highness. I've been to the gym. I've run the dogs. I've been through emails. And I'm still ready for more. Because my hormone levels are optimized. And I recognize the need to what? Earn my reward. What will my reward be? I've said it before and I'll say it again. So, low testosterone can unfortunately lead to low motivation, low drive, low determination, lack of self-esteem, low confidence, lots of negative attributes. Now, that's not to say that going on testosterone is going to reverse all that, because there needs to be something in the back of your mind telling you you need to do it. But disappointingly, low testosterone often just doesn't allow you to do it. I know I need to exercise, but I just can't. I know I need to eat right, but for some reason, I just can't bring myself to eat the right foods. So as we've discussed before, comfort eating. So what should you do? Well, if you've got a confirmed deficiency and you have, to your very best, tried to address lifestyle, diet and training, you should consider testosterone replacement therapy, because normalization of your male androgen levels can be that missing link. It can give you the capacity, the ability to do the things that you want to do, you know you need to do, but for some reason you can't do them. Now, it is not going to do that for you. So please understand that. It isn't a cure. It's a tool that you need to use to do what? Go earn your reward. It's an incredibly important point, because the guys that do best on TRT are the guys that are motivated. And that's not to say if you're morbidly obese, you can't go on testosterone replacement therapy, because I really do hope that you've tried to lose weight. And obviously you are failing. You haven't failed, but you are failing. And perhaps testosterone can be that tool to allow you to lose weight and to become healthier. Testosterone will increase your lean muscle mass and decrease your visceral fat. So it will increase your metabolism, and it will help you lose weight if you put the effort in. Now, my guy last week, he lost 30 kilos in 12 months. Amazing effort. What did I say? I congratulated him and I said, there's still room for improvement. I gave him positive reinforcement, but I didn't say, oh, well done, now it's time for a bit of R&R. You need realistic goals. You need somebody to tell you truths. So I am a fan, as you may have gathered, of tough love. It's the only way you're going to get off your asses and do what you need to do. Because, just Netflix and chill. Energy saving this, energy saving that. What are you saving your energy for? I've no idea. Keep busy. The happiest people I know are the most productive people I know. Not necessarily busiest, the most productive, because you have to be not only productive, you have to be in the moment and concentrating on what you need to concentrate on. If you're stressed and you've got anxiety, you may perceive yourself as busy, but the time that you are supposed to be concentrating on completing a task, it is ineffective and ultimately unrewarding, because you're worrying about something in the future. So that's actually not helpful. Testosterone should help you with that. But as we all know, Anxiety is multifactorial. So don't think for 1 second that testosterone is going to take away all your problems and you're suddenly going to be in this utopia, because that is not true. However, as I've said before countless times, it is a necessary foundation. It's a building block. What you do with that tool is up to you. The guys that don't do well on testosterone replacement therapy think that I'm on TRT, I can do what I like. Now, why did you need testosterone replacement therapy? It's likely that your lifestyle, your diet, and your training was not on point. Most people's lifestyle, training, and diet are not on point because we are disappointingly inherently lazy. And when you've got low testosterone and you've got all these negative symptoms associated with low testosterone, low mood, fatigue, low libido, etc., etc., you are looking for a solution. You're looking for a cure. Now, TRT will give you the foundations to go reverse those negative symptoms, but it isn't going to do it for you. So, what else? Is there anything else? Well, let's just summarize. Low testosterone, negative symptoms. Normal testosterone with effort will allow you to do what? Earn your reward.